Hi there, this is Terry Scott, nurse practitioner and registered nurse delegator in the state of Washington. I welcome you to my most recent training, The 6 Rights of Medication Administration. Remember that as a CNA or HCA working as a medication technician, you are giving medications under the authority of your delegating RN, not your own license. Today we're going to review the 6 rights of medication administration and why checking each one of those steps helps keep residents safe. This should take us about 5 minutes. Before we list the 6 rights, let's talk about why they matter. As a med tech, you're performing a task delegated to you by an RN. Now, granted, not all residents are delegated. If they have the competency and awareness that they are taking a medication, they may not necessarily be delegated, but the 6 rights still apply to those residents. Every medication pass is a chance to keep someone safe or a chance for a mistake. The 6 rights are our safety checklist. Here are the 6 rights: the right resident, the right drug, the right dose, the right time, the right route, and of course, the right documentation. Let's take a look at each one of these. The right resident means you confirm that you have the correct person. Now that's kind of a sticky wicket here in assisted living facilities, particularly if you've been there a long time. You may know these residents very, very well, but please try not to just rely on memory alone. Remember, you can only give medications to residents your RN delegator has assigned to you if they are a delegated patient. Again, not all residents are delegated. The right drug means matching the label on the bottle to what the MAR says. Watch out for look-alike and sound-alike drug names. As a med tech, you only give what the RN has delegated and documented on the MAR. Compare the medication label with the medication that you see and look at the name closely. Brand name versus generic name. If you're confused, look it up. Call your supervisor or ask your nurse delegator. My suspicion is you have a drug book somewhere there or have resources online. Do you know that you can even look up a pill by the shape it is, the color it is, and any markings it has? The computer will tell you exactly what that drug is. The right dose means the exact amount ordered. Never estimate. Use proper measuring tools for liquids. That would not include a teaspoon. As a medication technician, you never change a dose yourself, and there should be no sliding scale outside of insulin with very clear parameters written. If you're confused or are suspicious that we're missing information, call your supervisor or your nurse delegator, and we will work through it together. The right time means giving the medication in the correct time window set by your facility's policy. If you miss a window, don't decide on your own what to do. Always notify your supervisor or your delegating nurse. Timing matters for certain medications like insulin or heart medications or thyroid medications. Some antibiotics can't be given with certain food sources or milk sources, so it's important to know what that drug is and whether or not there are other limitations. The right route means giving the medication the correct way, like orally by mouth or on the skin, or if it's crushed, it needs a crush order as well. Only give medications by routes that are part of your skilled checklist and it's part of the order. You can ask the pharmacy to review medications to see what is crushable and what is not. Right documentation means charting accurately and right after giving the medication. Never chart in advance. Your MAR entry is proof that you carried out the delegated tasks safely and as trained. If a resident refuses a medication, document that as well. You're not going to be in trouble for that, but if it's a consistent issue, then the provider needs to be aware. As needed medications, also known as PRN medications, will require a follow-up check in 30 to 60 minutes after they are given. You want to ask the resident if the medication worked and document what you find. If it didn't work or if something seems off, this is not your call to manage alone, so ask your supervisor, your colleagues, or your delegating RN. This step is often forgotten, but is very, very important to the continuity of care and patient safety. As a medication technician, you're working under delegated authority, not independent judgment. It's always okay and always expected to stop and call if something falls outside of the 6 rights or outside of what you're trained and approved to do. If you feel like you need more training in any particular skill, don't hesitate to ask. I would way rather have a phone call and we can work through job aids or hands-on training to get you to the skill level that you need to be and want to be. Proficiency is key, safety is paramount. Okay, so let's recap. Right resident, right drug, right dose, right time, right route, and right documentation. And always follow up on a PRN medication 30 to 60 minutes after, and always call your delegating RN when something falls outside of what you expect. Remember, this is for educational purposes only. It's not intended to give you medical guidance, but I appreciate your time very much. Should you have further questions, my contact information is in the nurse delegation binder that you should have easily accessible to you at any time. So good to talk to you.